Fibromyalgia. Now, this is one of the toughest conditions to deal with. I can't even imagine what it's like to be a patient. It's got to be just awful. But as a chiropractor, I'm always looking for what is causing things. And one of the interesting things about fibromyalgia is the new thinking now is that it's a neurological condition, that for some reason the nervous system is hyperexcited in some way or damaged, and it seems as though the only option that doctors give patients are Lyrica. So what I'm going to do is I'm going to give you a checklist, just a thing to have for yourself to check off the box and make sure that you're looking at other things that can mimic symptoms of fibromyalgia. Now, I personally have been successful in this type of situation where a patient comes in and they've been either diagnosed officially with fibromyalgia, or they suspect they have fibromyalgia, or they were simply just told by their primary. And without looking at other things, because some conditions seem to have almost the same exact symptoms as fibromyalgia. Now, I'm not going to bore you with the history and the symptoms of fibromyalgia. We're just going to jump right into it with the checklist. Now, the checklist, number one, I think to look for is you need to see an endocrinologist. I often refer my patients to an endocrinologist to have at least their thyroid checked and their adrenal glands checked. And the reason why is because when your thyroid is off, it just throws your whole body off. And many of the symptoms of a thyroid are extremely similar to fibromyalgia. Now, some patients have had tremendous relief by getting their thyroid or their adrenal gland in check. Others have only improved their symptoms maybe 20-30%. But that's the whole point, is if you have a thyroid that's contributing to 20-30% of your symptoms, you've got to get that dealt with. The second thing is Lyme disease. Now, we live in Southern California and it's popular to go hiking and people do travel. Lyme disease is something that's kind of one of those unknowns. People all think that if they get bit by a tick, they're going to have a big circular rash. And the statistics are all over the place, but essentially consider that about 20-30% of people are not getting the rash at all. In some places I've read that up to 80% of people don't get the rash. So just because you don't see a rash doesn't mean you have not been bitten by the tick. And so it's always a good thing to go to a doctor and get that checked out. Sometimes I've had patients tell me, well, I didn't get a rash, so my doctor doesn't want to test for it. Find a different doctor and get that tested. It's always good to just make sure that box was checked and that you're not dealing with that. Another thing is the diet. Now, the issue with the diet is it's hard to know whether the diet is the cause of fibromyalgia or that the diet just contributes to it. But for most people, changing things in their diet can play a significant role in how they feel. Again, if we base fibromyalgia on the assumption that the nervous system in some way has been damaged, there's only a couple ways you can damage the nervous system, either emotionally, chemically, or physically. And here's the thing, is that it's possible that our environment, including diet, is chemically destroying us. So getting off things like gluten, getting off sugar, making sure that you're not eating things that have essentially poisons in them. One of them in particular is NutraSweet. I don't think there's any reason why we should be consuming anything with NutraSweet in it. That stuff is just bad. It's considered a neurotoxin. So there are certain things that we can control, such as our diet, and there's certain things that we just don't have any control over, like things that are in our environment. I live in an area where there's a lot of farming, and I'm sure they're going and spraying stuff. That can affect our nervous system. Household cleaners, things of that nature. We all know we're not supposed to mix bleach and ammonia, but what about all these other chemicals that we're using in our house? If we can eliminate these things that harm our nervous system, very often we can have some benefit from it. Sleep disorders, sleep apnea. I remember many years ago there was a study done where they took college students and they were perfectly healthy and they deprived them of sleep. Every time their brain became that REM sleep, they essentially shocked them and woke them up. And what ended up happening was, after a couple days, all these students got moody and depressed. After a week or two, they literally developed symptoms of fibromyalgia. And then it took months for them to regain their normal feelings after getting normal sleep again. Well, imagine never having any sleep at all. Imagine never having that restful REM sleep that stimulates that growth hormone. These people have to be just exhausted all the time. And of course, the question is, does sleep deprivation and lack of REM sleep cause fibromyalgia? Or does the pain from fibromyalgia and the pain from all their trigger points prevent them from sleeping? It's unknown, but there are a tremendous amount of sleep studies, and somehow or another, if you can get better sleep, that's something, again, to just check off the box. Trigger points. Now, some people have many physical injuries to their spine, particularly to their neck. They've had a history of traumas, and you can have trigger point issues all over your body. And when that happens, sometimes people mistakenly call that fibromyalgia. I personally have found that two things help with trigger points. The first is cold laser therapy. Class 4 cold laser, a deep cold laser therapy helps with trigger points. We have specific, in our office, trigger points that we find that people think are fibromyalgia, and we use a cold laser on them, reduce those trigger points. People feel tremendously better. The second thing is, doing hard trigger point therapy generally doesn't work on these patients. A very gentle heat with a very gentle trigger point with a very slow stretch very often helps. And even if it only helps 20%, that can significantly help people's pain. But some people think they have fibromyalgia, and they just have a rampant myofascial pain syndrome from trigger points. So again, another thing to check off the box. Depression. Now, this is a tough one because there really aren't a whole lot of blood tests. The only way to know is to seek a counselor, and they start giving you medications. We know that people have chemical imbalances, and the only way to know that is to restore those chemicals back. You can't do a blood test really of the brain. But the thing is that if a person has clinical depression, again, the sleep becomes deprived, lack of exercise, there's a whole host of things that occur. So depression and fibromyalgia can sometimes go together. Now here's the thing I've asked patients in my office is patients that have these pains and they say they're depressed. Sometimes I'll ask them a question, well, if you didn't have the fibromyalgia, would you be depressed? And a lot of them say no. Now there's a difference between having fibromyalgia and being depressed because of it versus actually having clinical depression. So the thing is that sometimes they're separate, sometimes they coexist. But getting the depression handled sometimes can have an effect on the physical pain that you feel with fibromyalgia. Exercise and sunlight. Now here's another one that is tough, but there's a tremendous amount of vitamin D deficiency where vitamin D deficiency actually has all these symptoms, and many of the symptoms are very similar to fibromyalgia. So they just compound them on one another. The problem is everybody's afraid to go out in the sun because they're all afraid of skin cancer. Or if they do go out in the sun, they're all using 50 sunblock. So the thing is that we recommend 20 minutes a day getting out into the sun, letting the sun hit your arms, your face, your upper body, the majority of your legs, your feet. So again, very controversial, but to me, vitamin D is an important thing. Also, the sunlight actually helps with our mood, and getting exercise. Now, the thing is, we made another video about exercise and depression, but when it comes to fibromyalgia, most patients are in so much pain they cannot exercise. So again, that's where chiropractic fits in, where if we use cold laser therapy on the trigger points, we do adjustments that alter the tension on the nervous system. Very often we're able to reduce their pain enough that they can get some exercise, and the exercise affects your mood and it affects your general circulation in those muscles. Mercury in the teeth. This is a controversial subject, but again, what is poisoning our nervous system? In the old days, they used to use mercury fillings, And that mercury, of course, there's a blood vessel that goes into your tooth, so the mercury can get into your bloodstream and essentially become toxic to your nervous system. You certainly wouldn't take a thermometer, break it open, and suck down the mercury. Well, if you have a cavity, an old cavity, and that mercury is getting into your bloodstream, that's essentially what's happening. So I recommend to patients to go to their dentist and have those old fillings replaced that don't have mercury. Now, this is a controversial subject, so sometimes you can go to a dentist and they'll say, oh, they're perfectly fine, they're perfectly safe. You might need to find a dentist that's willing to take that mercury filling out. There are some precautions that those dentists do. I have a number of dentists in my town that will do that and do take the appropriate precautions. Now, the thing is that sometimes people will say, well, that's expensive to do. Well, of course it's expensive, but you know, when you have fibromyalgia, what else do you have to do to spend your money on other than trying things to improve your health? But if you have mercury fillings, this is something to, again, if you haven't checked that box and looked into, it is something to consider. Neurotension. This is something where chiropractic really does wonders for patients with fibromyalgia. Sometimes with fibromyalgia, patients go to doctors, and all they get are medications, and they don't really get a whole lot of physical treatment. There are some things that say that injuries to the actual spinal cord itself, by creating tension in the spinal cord, can actually create symptoms similar to fibromyalgia, and it mimics those symptoms. So what we do when we do that is, when I adjust patients, we try to alter the spine in such a way that actually reduces neurological tension on the spinal cord itself. Now, I know this is YouTube, and there's people that don't really understand chiropractic and think that we're just cracking bones and stuff like that. We are not doing that. In these particular patients, we're doing specific adjustments to alter the tension on the actual spinal cord. Because patients with fibromyalgia sometimes have a tremendous amount of pain, what we do is we use the arthrostim to do those adjustments, and they're much more comfortable and much more effective. Another thing to consider, again, just something to consider, is if you have had a lot of injuries to your body, particularly your spine where the nervous system is, sometimes people will have joint instability. Now, if you have joint instability, chiropractic adjustments are not appropriate for that, and most chiropractors know this and are not going to do anything to harm you. But the thing is, in those cases where there's a joint instability, you either have a question of should you surgically fuse that area, or there's another method, it's a medical method, so we refer out for this, is to have prolotherapy, PRP, stem cell injections. Those are all just progressive treatments that can help stabilize unstable segments in our spine. If there's an unstable segment in the spine, it can, of course, produce neurotension and tension on the spinal cord such that it creates a tremendous amount of neurological frequency that's just wrong, that causes widespread pain in the patient. The last thing to think about is a fungal infection called Candida. And this is something that you can look online and talk to your doctor about. But if that is what you have in your gut, you are simply not going to be able to heal the gut, and you're going to have symptoms all over, almost an immune reaction to this. So I hope this video was helpful. This is how our process of thinking is in our office. When a patient comes in that does have fibromyalgia, we try to look at them from a chiropractic perspective, but also what was that original insult? Is it genetic? Is it something environmental? All these different conditions that can contribute to harm to the nervous system. And by checking off all these boxes, sometimes what happens is you'll actually find something that can significantly help that patient reduce their pain that was actually the cause of the majority of their symptoms, such as thyroid. So if you thought this video was helpful, give me a thumbs up. Ask any questions in the comment section. If you have a reasonable question, I'd be willing to answer them here on YouTube. Thanks for watching.